We're so glad that you could all be here tonight for Being Well with Philadelphia Integrative Medicine, a virtual talk with your PIM providers during these changing times. Today's topic is how to source support. Before I turn this over, I have a few quick announcements to make sure that your online experience is smooth tonight. So the first thing I want to mention is that for those of you who may be new to Zoom, it will function much better if you're able to close down any other programs that you have open and running on your computer. If you have any technical problems, make sure that you've closed programs like Skype or any messengers. And of course, if all else fails, just quit the meeting and rejoin via the link you received when you registered. Later on tonight, we're going to have an opportunity to do some Q&A. When that time comes, I'll give you the instructions again, but just so you know, there is a Q&A button right at the bottom of your Zoom screen where you can type in questions. We will be taking written questions only, so feel free to type in your questions as they arrive as we move through the presentation tonight. So for those of you who don't know, Philadelphia Integrative Medicine is run by a team of wonderful providers spearheaded by Dr. Georgia Tetlow. Dr. Tetlow is a clinician and a mentor to clinicians. She is board certified in integrative medicine, clinical assistant professor of rehabilitation medicine at Sidney Kimmel Medical College at Thomas Jefferson University, and founder of Philadelphia Integrative Medicine. In June, Philadelphia Integrative Medicine celebrated 10 years of serving patients, the surrounding community, and the healthcare system at large. Dr. Tetlow is not only a leader in the medical community, she's the heart of PIM. Tonight, she is with us all to share an important message. She wants each person to experience their best health. This is what truly sets Dr. Tetlow and Philadelphia Integrative Medicine apart. So without further ado, it is my great joy and pleasure to turn this over to Dr. Georgia Tetlow. Welcome, Georgia.
Thank you so much. I'd like to start our free evening class with centering, a meditation, and we've been doing these for years, and this is always how we start. So this is an opportunity to gather yourself, to enter into the present moment. If it helps you to lower your gaze, or even to close your eyes, I'll invite you to get comfortable and to take a moment. I'll invite you to allow your breathing and to feel your feet. There's so much to pay attention to right now, and seeing if you can include yourself in what you pay attention to with as much gentleness and compassion as you can bring. This evening is about learning, listening, sharing, and support. Beginning to deepen your breath, and I'll just invite you to come on back, and sometimes it can feel really good to stretch, to move your body in a way that feels comfortable. So one thing we want to do is to learn a little bit more about you. We want to share why we're here tonight, and our intention is to source support. To source support for ourselves as healthcare providers, and to also source support for you. It's key that you hear from your healthcare providers at this time. And it's also key that you hear a healing message. It's one of the big reasons that we're here tonight. We'd like you to feel more connected to yourself and to your community. And we want to let you know that we're here for you and actually have you know and feel that. We hope that you leave this evening with action steps at this great time of change. We'd like to learn a little bit more about each of you, and down in the polling section at the bottom of your screen, you can click on that and answer some of these questions so that we can see who's here tonight and how you've been affected recently by ongoing events. So please take the time to open that poll and to let us know. I can say that as a group of healthcare providers, we've been providing patient care all day and had a full day. Every slot was full today, and it's been quite a ride. So I'll just give you a few moments to complete this poll. We think this will just take a few more seconds. Thank you for taking the time to let us know more about you. This will also help us to serve you more as we continue to reach out to you and be available to help provide the needs that are really important in our community. I can see that many of you are responding, and we have a lot of clear answer to some of the questions. In a moment, we'll be sharing these poll results with you so you can also see who's attending. We've surpassed our expectations of who would be logging in tonight and participating in the webinar. So we'll just give you a few more moments, and our moderator will decide when it's time to end the polling. And at that time, you'll see results, and I'll just briefly speak to them.
Thanks, Georgia. Just want to let you all know that, as Georgia mentioned, we do have quite a bit higher volume than we expected. So I'm going to go ahead and leave the poll open for another 20 seconds. And if it looks like we need to revisit this later on in the call, we can. We really appreciate you sharing a bit about yourself, and do keep in mind that all of your responses are anonymous. All right, I'm just going to take one more moment here, and I'll go ahead and end the poll with about 60% of our participants reporting, and I'll go ahead and share those results so that you can all see. If we cut you off while you're responding, I do apologize, but we hope to hear from you afterward.
So just to summarize some of our results, about 1/3 of us have children at home. 10% of us have recently lost our job. 50% of people participating tonight are currently working from home. And about 2/3 of us are familiar with Philadelphia Integrative Medicine and with our clinic, and 1/3 are not familiar and are new. It's actually at least 1/3, maybe up to a half, are finding out about Philadelphia Integrative Medicine for the first time, and also about an integrative medicine model and an integrative approach to this crisis. 3% of us on the webinar tonight are having difficulty getting food. 97% are not having difficulty getting food. 6% have reported that they need to talk to someone or a therapist. 13% of the people participating tonight are supporting a life-sustaining service. So this includes our emergency services and our healthcare providers and many of the delivery services, and the list goes on and on. Thank you so much for supporting us. Thank you for taking the risks that you take that allow us to stay in our homes for those of us who are privileged enough to do that. And we really appreciate you. This evening is dedicated to you, and it's very moving to me, the choices that you're making on our behalf. I'm very grateful. We have some additional answers, and that is you're letting us know some topics that you'd like for us to cover. And a large percentage of you would like to understand more about self-care for healthcare providers. A large percentage would like to know about hormone balance, weight loss, Nutrition topics are actually the most prominent response. Nutrition is a request from the community tonight. Another question is, what are you doing for self-care? 3/4 of us are exercising. 90% of us are taking walks. 60% of us are meditating or reflecting. 3/4 of us are cooking and focusing on nutrition. 42% are hugging a family member in our home. 2/3 are reading. 3/4 are getting daily sunlight. 60% are resting more. And 3/4 are connecting with friends. Thank you so much. We'd like to transition now, and I'd like to introduce an exercise that we often and frequently share with our patients in the clinic. So we are licensed healthcare providers in Pennsylvania. We are conventionally and traditionally trained, and we're all board certified, but we're also an integrative clinic. So what we do is we also incorporate mind-body medicine into our appointments. So we prescribe medication when it's appropriate. We are aware of botanical medicines and supplements and the many ways that we can have less invasive approaches to approach your healthcare. Many of our patients are seeking these less invasive approaches, but are also extremely well educated and are ready to partner for their care. I'd like to share a 4-7-8 breath just to give you a tool that you can use immediately. This is a breath which includes breathing in through your nose and breathing out through your mouth audibly with a whoosh like this. So there's a timing to the breath where you breathe in through your nose for a count of 4, you hold for 7, and you breathe out through your mouth audibly for a count of 8. The reason that we teach mind-body medicine in the clinic, and the reason that I'm sharing this with you tonight, is that doing this type of breathing is an ancient practice, and there's a lot of documented evidence-based effects about how it can affect our nervous system and our autonomic nervous system. Our autonomic nervous system is intimately tied to our immune system, our blood pressure, and all the regulation of our body systems and visceral organs. So when you do these types of breathing, you help to reset and regulate your nervous system. This is incredibly helpful in times of stress. So let's do this together. We'll do 2 rounds, and I'll guide it. So I'm going to encourage you to breathe in through your nose for 4, hold for 7, and breathe out audibly through your mouth for 8. We'll do that twice. So if you're ready to participate, and it's great to involve the kids, you might have sons, daughters, aunts, uncles, sisters, brothers, and we'll do this together. Breathing in through your nose for 4, 1, 2, 3, 4, holding for 7, 2, 3, 4, 5, 6, 7, out through your mouth with an audible whoosh, 3, 4, 5, 6, 7, and 8, and breathing in through the nose for 4, 2, 3, 4, hold for 7, 2, 3, 4, 5, 6, 7, out through the mouth, 2, 3, 4, 5, 6, 7, and 8. And that's something that you can do all the time, whether or not you're working and protecting us and in your life-sustaining work inside the home, outside the home. And we hope that you use this tool. Just a little bit more from me before you hear from the rest of the team. Tonight we're talking about an integrative medicine approach to self and circumstances. So everything that we're talking about is addressing root causes. We're looking at where phenomena comes from. Where does health come from? Where does recovery come from? And also, how did we get here with this viral pandemic? Everything we do in the clinic is science-based, and we're very proud of the care that we provide every day and that we provided today. We'll look at your role. What is my role, and what can I do? What's in my control? Can I listen? And what do I choose to listen to at this time when there's so much media and so much coming in and stimulating information for us to respond to? Can I turn toward my own experience, my own feelings, my own responses, my own fears, my own feelings? And we'll be talking about a combination of the best of conventional and evidence-based complementary medicine. What we do is not about fixing. It's about partnering. It's about caring and working with you and experiencing and sharing in a compassionate lens. We can care for you, and we can care for people who are all over the world. If you are in Pennsylvania, you are eligible to receive paperwork and a receipt so that you can apply for insurance reimbursement through your insurer. You don't need to do that. Our care is available to everyone, but in terms of insurance reimbursement and paperwork that we can provide today, you would need to be living in Pennsylvania because that's where we're licensed. Telemedicine is available worldwide, and we treat all forms of chronic illness. Without further ado, I'd like to introduce one of my wonderful team members. I'd like to introduce Erin Urikar. Erin is an incredible team member who participates every day to discuss our patient care. I'm so glad to have you tonight on the webinar.
Thank you, Dr. Tetlow. I'm very happy to be here. And good evening, everybody. Happy that you joined us this evening. And so what I'm going to be talking about tonight is about nourishing yourself, not only with food, but with lifestyle that is available to you. So in reflecting on my own recent experience with meal planning and doing some online food ordering, I thought I'd share some strategies that have worked for me, and perhaps you're doing some of these, or perhaps these would be new strategies that you could try. So one would be to take an inventory of what's in your pantry, your refrigerator, and anything you have in an online order. And this is really to know what you have and how to divide the ingredients you have at hand across meals. Another strategy would be to simplify your meal planning and preparation. And so this would entail finding recipes that had 1 or 2 ingredients in them that you want to use, that you have available to you, trying to keep it simple by maybe focusing on using 5 ingredients. This may include a carbohydrate, a fat, a protein, and some type of seasoning. And then for sources of protein, if that's something that you don't have readily available, you could use bone broth, protein, or collagen powder as a source that you could add to soups, stews, and or smoothies. Another idea that you may want to think about is substituting items in recipes for items that you already have. So if you have a recipe that requires leeks and you don't have those, you could use onions instead. Or if you're running low on fresh herbs, you could use dried herbs or ground spices instead. Also making cooking to be an opportunity to be creative in this time. So I invite you to find ingredients that go well or complement each other. So for instance, you could do a stir fry that's very basic, that would include coconut oil, garlic, some ginger, veggies that you have, and any protein that you like. Also be open to trying new foods and new ingredients that are available. So a personal thing for me, on a recent online order, I never tried shirataki noodles, so I ordered those to use in noodle dishes, soups, and salads. I also ordered some canned mackerel, which is a good source of protein that's low mercury and also high in omega-3 content. And lastly, around the whole food preparation and nutrition, nourishment from food, is just to be kind to yourself and give yourself permission to not follow a perfect diet in this time, whatever that may mean for you. So be it organic, pasture raised, grass-fed, wild caught, really do the best you can to eat whole food and to nourish your body with what you have that's available. The other essential piece of wellness and other nourishment, and I was very happy to see on the polling results that many of you are already practicing these things, so I applaud you for that behavior and doing these practices, is getting nourishment from other sources. So getting fresh air and sunlight, going outside on a deck or out into your yard. Many of you responded high on the rest, so setting a bedtime and a wake time and adhere to it. Tomorrow is another day. Give yourself some time to get some sleep and rest so that you're productive and clear thinking the next day. Also get some exercise in, do some type of movement. Many of you are working from home. That may mean standing occasionally throughout the day if you're sitting in front of a computer all day long, going up and down flights of steps in your home, doing some occasional stretching, whatever works for you. And also embracing a healthy inner life. So that might mean journaling, meditation, which many of you are doing, a spiritual reading, poetry, a daily devotion, an inspirational podcast, or an online worship service. And lastly, making sure that you schedule time to be with family and friends, whether it's in an existing household or it's with a virtual type of connection. So I applaud many of you that are already doing these things, and I hope this was helpful for many of you out there. Thank you so much for your time and attention. It's an honor to be here. And I'm going to turn it over to my colleague, Linda, at this time.
Thank you so much, Erin. I'm Linda Sherlin. I'm a family nurse practitioner. Joined PIM in June from Texas. So I love PIM, and you might be noticing some themes tonight as we go through and each of us speak. And I love to speak with my patients about creating resilience. We talk a lot about stress management. When I think about stress management, I think of having something by the neck. And, but really, when we think about building resilience, and we really like to think in integrative medicine and functional medicine about what we're adding in, what we're building. And so resilience is the ability to withstand or recover quickly from difficult situations. And boy, don't we need that now. You know, we're in a challenge every day. Something new pops up. And so I like to think about what can we do to recover quickly. And I loved seeing the poll, just like Erin said, these wonderful things that you're already doing. And when I think about creating resilience and facing difficult times, I think about what brings you joy. There you're seeing on the screen in the slide, our team, having fun outside, getting a little crazy, and playing together. That was a party we hosted recently before we couldn't have a party together. Now we party every morning together on Zoom. But think about what brings you joy. What, just as Erin said, what foods do you like to eat? What feels nourishing to you? Think about creativity. And, you know, sometimes we'll say, I don't know if I'm very creative. I can't draw a straight line. You know what? If you can't draw a straight line, draw squiggles. You know, anything that brings you joy. I'm kind of like a country music fan. So what I've been doing is watching these performers that are doing live shares and are having little concerts. Nicole Kidman dancing around with her husband the other night as he was playing, you know, and just thinking about those things that are fun and that bring joy. Movement. Tonight, it says we're going to dance. I'm so sorry. We're not dancing, but if you could all just get up right now for a few minutes and let's stand up. I don't know if you're like me, but as Dr. Tetlow said, we've been sitting all day. We've been on the phone with our patients, taking care of our patients and of each other. So, you know, I know we don't have music, but like we can kind of shake it a little bit and get up and move around. You know, I promised my sisters, tune in, watch the video because I'm dancing. They're used to that. So that was our attempt. But, you know, find the music that you love. One of my favorite songs is The Happy Dance by Mercy Me. That's a great one. Look it up. There's a podcast, you know, put it on. Have a dance party. Have a Zoom dance party. There's so many things, all of the things that were listed in the poll, getting outside, getting some sunshine, having Zoom chats with your friends. Who knew that was a medical intervention? And the rest that we're getting now, the downtime that we're getting now, you know, I'm telling patients in every visit, your cortisol is too high, it's too low, you're too stressed. And right now, we have this beautiful opportunity to move a little slower. Maybe we don't have to get his work so early. We certainly aren't having to fight the traffic for most of us right now. And all of this is healing. It's all building resilience. It's building our immune system. And just remember every day, seek the joy in your day. And now I'd like to turn it over to Zoe Phillips, another one of our wonderful practitioners, and she's going to talk a little bit more about community.
Hi, everyone. Thank you so much, Linda. My name is Zoe Phillips. I'm a physician assistant, and I joined PIM in October. Just like the team here, I love what I do, and I'm really honored to be able to take care of our patients here at PIM. Tonight, I wanted to talk with you about building community. And I think one of the most important questions we all want to ask ourselves is, how connected are we? So I'd like for us just to start thinking about, what is our level of connection with others? Are we isolated? Do we go 3 or more days without speaking to loved ones? Are we moderately isolated? Do we speak to loved ones once every 1 to 3 days? Or are we well connected? Are we speaking to loved ones 1 or more times a day? This is an important question to ask, because one of the best things we can do for ourselves is to connect with others, especially right now when many of us find ourselves at home, not being able to meet up physically with our friends. But this should not stop us from connecting. There are many ways to do that. So what can we do? Well, one avenue that we can use is what we're doing right now, a Zoom call. Video chats are a great way to build that connection with others, where we can still see each other face to face, and we can still relate and share and laugh with each other. So we can do that via Skype, Zoom, FaceTime, Google Duo. The good news is that all of these things are free, and it can really bring a smile to our face. And we really want to make sure to be doing this at least once a day. And the good news is most of us are having some free time, and we're able to do that. And another thing that we can think about is maybe not, of course, in person, but from a distance. One of our coworkers shared that she was able to have a great conversation and enjoy a concert put on by her neighbors across the street. So it doesn't mean that we can't enjoy time physically, but definitely from a distance, and we recommend at least 6 feet apart. So now I'd like to have Dr. Tetlow share with us some of the takeaways.
Thank you so much, Zoe. I appreciate it. And I'm just so heartened to see my other team members, and also to see you here tonight. I'd like to share some take-home messages, but I also want to let you know that this is not the first video that we're creating, so there is a little piece for you to get caught up on, and that is that we've already created a video which has everything to do with your role and the importance of sheltering in place, and how many of you have already discovered that and are practicing that, but there's whole pockets of our country and whole pockets of our world that are not. So it's important for us to spread this message and to communicate, because we are actually the answer to this pandemic. What I mean by that is, this is a viral pandemic, and a virus requires a host in order to continue itself, in order to survive. So if we actually shelter in place, we not only protect our own family and our own self, our own safety and our own survival, but what we also do is we contribute to the communal solution. So if each of us were to shelter in place for 2 weeks and not provide any new host for this virus would die within 2 weeks. So we're not able to shelter in place in that fashion. Many of us are on the front lines and also supporting each other, for those of us who are at home. But spreading this message to people who have some control about beginning to shelter in place voluntarily can make a huge difference. And what that will mean is that we are going to shorten the quarantine, save lives, and contribute to the solution, because this virus needs us in order to continue. We can listen tonight, we can change. The actual solution that we're proposing through my original video that was from March 20th, which is available on YouTube, we don't need any more data. We don't need any more developments. We are waiting and hoping for these treatments, medications that can help prevent coronavirus and COVID-19 infection. We're hoping for vaccines, but actually we have the data and the information that we need to play a role now, which means sheltering in place, spreading that message, and also being safe. And we'll discuss in the question and answer about how you can be safe and not bring coronavirus into your home. We've got a lot of questions in the Q&A for us to address those specific concerns, and we want to help you answer those. So I'd like to make another transition, and we do have a summary and also a call to action for you. So we're talking about an integrative medicine approach, and we're also talking about how we're going to get through this together. In terms of our call to action, so just being clear with you, what we're asking you to do, and what we see as your role, how you can enlist the help of your friends, your network, your loved ones. We do want you to encourage others to learn that we are here as a clinic and that we're providing care. We have free consultations for you to learn about what we do and how it can help you personally. Those phone conversations can happen very easily. They're very easy to schedule, and they're with one of us, the people that you're seeing tonight. We encourage you to join our newsletter and to stay connected with us. We're very intentional about the messages that we send. So you will get healing messages, supportive messages, and action-based options from us. And people like to read our newsletter. They look forward to it, and we love to share through our newsletter on a regular basis. We are a virtual clinic, and we're here for you. Please help us to encourage to share the YouTube video widely. That's the one that talks about how we can prevent this virus together by sheltering in place and spreading the word. And our next installment, this is a virtual talk series with your Philadelphia Integrative Medicine providers. Our next installment will be in 1 week's time on Wednesday night, April 1st at 8 p.m., similar to tonight. So it's 8 to 9 p.m. Eastern Standard Time. And we'll be sharing how you can honor yourself. We have a curriculum that we've had in place for some time, which includes a self-assessment questionnaire, tools for you to see what is most important for you for your self-care and how to figure that out during the session. And then there'll be opportunity for interaction and also to do a special interactive tool, which we call the Tetlow 10. It has to do with actions and attitudes that are personal to you that would really make a difference. We want to thank you so much for participating tonight. We'd like to let you know that we're here for prevention visits and for regular appointments. We'd like to open things up for question and answer, and that's an opportunity for all of my healthcare providers for you to see us collaborating together, for you to see how we work, for you to know that we're here and that we're listening and that we do care a lot about you. Thanks. Let's transition to the question and answer. So I will ask for our moderator at times to assist us. I have been reviewing some of these questions as they have come in. So I'm also looking at my fellow presenters, and you can let me know if you'd like to make a comment about some of these questions that are coming in. Many of you are talking about working from home and some of the challenges related to that. You're trying to balance work and stress, and thank you for sharing about that. I'm also reading some comments, some sharing about, I'm nervous because work is slowing down. Others are worried about their family members of all ages, including older family members. We also have some questions about food delivery, and I'd love to answer those specifically and also direct our audience to the CDC.org resources that have to do with safe food delivery. Those resources are very easy for you to click and read about how to order directly from restaurants that you trust, how to support these small businesses who are feeding us, nourishing us, giving us delicious and new tastes in our home. There's safe ways for us to accept these foods into our home, and so please follow those CDC guidelines. I'd like to open it up to my fellow providers and also encourage you to take some time to think about what are your questions for us. So we're here with you tonight, and we have some time to interact with you. So please consider what you'd like to ask us about, and we look forward to your questions.
Thank you, Dr. Tetlow. It looks like we do have a lot of questions coming in. One question is from Barb, who wants to know, can we get supplements from PIM during this time? And our answer to that is yes, you can. We use an online supplement company, FullScript, If you are a patient of ours, then you can absolutely order supplements through FullScript.
Mhm.
And I'm seeing some questions about stress, things about trying to balance work and stress, kind of like I talked about in that creating resilience. You know, think about when your chest kind of starts to tighten, or you get that feeling in the pit of your stomach. You know, I'm not sure what's going to happen. I'm getting nervous. 4-7-8 breath. You know, and we've got resources on our website as well. And so you can go and click in and just do some 4-7-8 breath, 4 rounds. It's amazing. 4-7-8 breath just kind of calms everything out. And when we're thinking with our frontal lobe, when we're nice and calm, then we can make better decisions. It lowers our worry. And in the things, then we can think about what do we want to do next. And, you know, sometimes we live a minute at a time. Sometimes we live an hour at a time. Sometimes we live it a day at a time. And I think some of these times right now, it's a minute, it's a breath. And if that's what it takes, give yourself the permission to really take it slow. Remember to breathe. Put your hand on your belly. You want to breathe all the way down to the bottom. And just have a thought about what could I do right this minute that would bring me joy, or that I could share joy with someone else.
These are incredible questions that are coming through, and we're going to be responding to these as a team. So there's questions about my mom is in independent living and I feel very guilty that she's not with us. Should I bring her home? Another question is about parenting 3 young children, and I'm really noticing that my temper is much shorter. I have less tolerance for noise and for chatter. And I'm finding that I need a lot more space. There's a question about whether or not a mom can get the space that she needs. So we'll be touching on these. I'm just going to speak to some of the questions that are coming through. There is another comment that has to do with a question for us, and I'd like to handle this as a team, so I'd like my providers to chime in. The question is it okay for me to go to the grocery store once a week? So that's a question about leaving the house and not ordering online for groceries, or not ordering takeout from a restaurant to have it delivered to outside your home in a safe fashion. Is it safe for me to go to the grocery store once a week? Is it safe for me to continue to go out and do some regular errands and activities? And I'd like to touch on this as a team and invite my team to respond to this question, because this really is an important area where we can increase our prevention of the spread of the virus, which is a communal solution. It's not just going to save us, it's going to save all of us.
I think that's so important. I think a lot of us are worried about how we're going to secure our food. One thing that we recommend is to utilize delivery services like curbside pickup or Instacart. This allows you to receive your groceries, and in doing so minimize your contact and your exposure to other people, and to also food items and products. So we do recommend utilizing these sources. If that's not an option for you, then one great thing to do is to have one designated person in your home who you can feel comfortable setting out to the grocery store, being very precautious of perhaps wearing gloves when you're at the grocery store, and taking them off before you enter your car, and making sure that you wash your hands thoroughly when you come home. Also making sure to sanitize the food that you bring into your house. But the best way to secure food would definitely be through a delivery service of sorts. Our advice for all of our patients is to shelter in place and to stay in their homes as much as possible. So if you can avoid going to the grocery store, we advise that you do that.
And I'd like to contribute to that as well, and just say, my own family, we've been sheltering in place since Friday the 13th of March. And it was a hardship for us, and it has been. And we have not left the house to do grocery shopping. And there was a period of days when we weren't able to get any of those windows for food delivery. And we didn't have a sense of when we would be able to replenish our food supply. So that was a stressful time. And we did make the commitment to stay home simply because I'd like to be, and my own family, I'd like for us to be part of this solution. I think that in terms of food delivery, there are options. We figured it out. Zoe just mentioned some of those. And to go out into the community and to do errands at a time like this is a big decision to make, not to one to be taken lightly. And I've taken that decision very seriously for myself and for my family. And I would encourage you to do the same. You can make the best decisions for you. And I do know that it will make a big difference, and our choices affect all of us and how long we'll have to be in this quarantine.
We also have a question from Janine. She wants to know, do I need gloves for everything, or is sanitizing enough? If you are staying at home, if people are not coming in and out of your house, then it's not necessary to wear gloves. We recommend wearing gloves when you do have to go out into the community, and making sure to change your gloves, although washing hands is another great precaution. The goal is to limit your exposure to people and to products that would allow you to contract COVID-19, which is contracted through droplets. So the best way to do it is, the best precaution is, of course, to wash your hands. And if you're staying indoors, then it is not necessary to wear gloves.
We've got another question from Megan, who's wondering about her 3 young children and her anxiety and needing space. You know, we all need space. And I think that we're used to being very available for our children and used to them having activities and things to do. And so I think one thing is, it's okay to ask for space and to say, I need some space right now. And that's going to be a wonderful thing. Even once we're able to go out, that children have learned, it doesn't mean their parents are angry with them or that there are any problems. It's just mom or dad need a little bit of space. They're going to go in the other room and they're going to be back. So letting them know, I'm going to be back. I'm just going to go in here a few minutes and I'll be back. You might leave them with something to do. Maybe they can color. Maybe they can unload the dishwasher, depending on how old they are. But give them, you know, an activity. Another thing is, there are lots of meditations online, like Headspace, Insight Timer. There are meditations for kids. And so if everybody's needing some space and some quiet, you know, bringing those up and doing those with the kiddos, so that they can learn it. And it's kind of amazing, once the meditation starts by the parent and that breath starts flowing and the energy starts to come down and it's calm, kids just kind of seem to join in and want to be quiet as well. And if they don't, that's okay. You know, another thing is, just leave them having a dance party while you go in the other room. And it's just, you know, we're doing the best we can. And I think the biggest thing is, forgive yourself if you feel like it's not enough, if it's not right. We kind of have these rules in our head, and when we're looking for joy, we're looking for that resilience. You know, forgiveness is a part of that. Humanness is a part of that. Saying, I apologize. You know, if it wasn't what you wanted, that wasn't what I wanted to do. Let's try something different. It's going to be a learning experience for all of us, but what a gift to our children to learn to do things differently that they've never done before.
Yeah. Thank you so much, Linda. I think that was really beautifully handled. Thank you so much. I appreciate it.
You're welcome.
Mm-hmm. We've got a lot of comments coming in, people pointing to the power of humor and laughter at a time like this. The role of stress reduction in our lives. We can have the same body, the same circumstances, the same family members that we're sheltering in place with, and we can have a different experience. We can be more relaxed. We can open to the experience. We can turn toward ourselves and our feelings and embrace. Thank you so much for this sharing. Some additional questions are coming in about food delivery. A lot of questions tonight about food delivery. So if you go to your phone after the presentation, actually it's not cdc.org, it's cdc.gov. The Centers for Disease Control has a whole section on food safety. It's called Meal Kit and food delivery safety. So if you've got questions about that and how to do that safely, go right to the source, get your questions answered, and then also after you educate yourself, then feel safe, feel relaxed, order food that would be delicious and nourishing for you and your family. Enjoy it. Don't eat in fear. And that's the power of education. And that's why we're having these evenings tonight, is so that we can give that power back to you and also give your life back to you. The quality of life that we all need, especially right now.
I'm looking here at a question by Christina on her pet. How about my dog? Can he curl up in my lap? You know, absolutely. I think we need our pets. We need our animals. And we need that support. I also saw a question from someone who feels like maybe they're not doing enough. They've been laid off. They're a provider. And, you know, don't we always feel like we're not doing enough as providers? And I think it might be a time to embrace the time off, reaching out to friends, reaching out to neighbors, get a group of others maybe that have lost their jobs too, and do a Zoom meeting. I think there are so many wonderful things that that we can do to maintain our purpose. And sometimes that comes to me, I know, in meditation, when I'm just sitting in quiet and maybe asking, you know, what is my purpose today? What can I bring? And I think we're seeing this all around.
Mm-hmm. There's a lot of questions tonight that have to do with the possibility, can I be reinfected? If I fell ill and then I recovered and then I'm symptom-free for 2 weeks, is it possible that I can get sick again? One thing that's really important to remember is that when we fall ill, we actually, unless we have some testing and some results, we actually don't know what we fell ill with. Did we fall ill with a strep infection? Was it a flu virus? Was it COVID-19 infection? And we simply don't know. So the answer is that it is a possibility that if someone has COVID-19 infection, because we're so early in understanding this particular virus, that one could actually get that again. But since we don't actually know sometimes if we've had that particular virus or not, the key is to continue to do prevention and to be very mindful and careful about this contact. We want our contact to be intentional, we want it to be loving, and we also want it to be conscious. So please continue to keep these guidelines in mind, and also to support your immune system and some of the ways that we do in our clinic. If you'd like to know personally how to do that, that's what our bread and butter. It's our wheelhouse to help you strengthen your immune system so that when you need to have the appropriate immune response to an insult, a pathogen, that you are as prepared as you can be. We have questions about access to the Zoom call. This call has been recorded, and because you've registered, you will receive a link to be able to review it whenever it's convenient for you. Everyone has had a very long day, I'm sure. This is a very busy time when we're asked to do a lot of new things. So we're not expecting everyone to be able to participate for the full time, and also we're understanding that some are going to be attending, listening to the webinar later.
We have another question from Lori, who asks, any thoughts about wearing a mask if we must go out? They say it's not a good idea, but I think it would have to help as long as we dispose of it properly. Right now, there is a major shortage in vital healthcare supplies, gloves, and masks. So I think it's really important for us to be cognizant of that. Many people have bought masks, and that has left healthcare workers who are on the front lines, who are treating patients with COVID-19 at a loss to where they need to reuse masks. And this is a problem. So it would be best to avoid wearing masks unless you are yourself in the presence of someone with COVID-19 and are giving them care as if you were a healthcare provider. So I would recommend against not wearing masks unless you're in that situation. And the same is true for gloves as well. We want those resources to be available for the healthcare workers who are in the hospitals taking care of these patients. Hand washing goes a long way. It's one of the best and easiest things that we can do. And again, being cognizant of that distancing between ourselves and others.
I'm also seeing a lot of questions, and other team members can speak to this as well. What about my connection with my family member who is in assisted living, or I have a family member with dementia? My relative is used to seeing me. Let's say it's my mom. Someone is sharing that they have 80-plus-year-old parents. My mom is living with dementia. My parents are used to seeing me come over several times a week. How much is okay? I do wear a mask and I sanitize. So this is important, where I want to encourage each of us to connect profoundly with our loved ones. Now is an even more important time for us to know and to communicate effectively with each other that we're here and that we care, and that when we have needs, there's going to be a response. We're going to reach out, and there's something there that's right there for you. I also want to ask you to think outside the box about how you connect, and whether or not that needs to be in person, especially if you are in a household with other family members and you're going into another environment to take care of a loved one, connect with a loved one, and to be there for them. This type of visiting has risks. And is there a way that I could still connect with my family member and do it in such a way that I'm not increasing their risk for getting the virus, or myself getting the virus, or anyone in my home household? I'd like to share a personal choice that my family made. I have an 84-year-old mom. Many of you might know about her if you're involved with Philadelphia Integrative Medicine. She's my mom. And my mom turned 84 on Monday. And to celebrate her birthday, she lives about 35 minutes away. Myself and my family, we did not drive to her house. We had her birthday via Zoom. And she said it was one of her favorite birthdays. And we cherish her. We love her. There's technology issues, whether or not some of our family members are capable of getting on a Zoom call, and especially when they might have dementia or have difficulties with instructions. So this is a very challenging situation, and I want each of us to forgive ourselves and also to think outside the box and not to sacrifice the connection ever. Lots of additional questions about grocery shopping and how can I safely receive food to my home. So I think we've addressed that. And there's a question about cytokine storm. There's been some recent literature that talks about some immune boosting supplements, potentially even increasing some of the immune mediators to the point that we call it a cytokine storm. So there's questions about that. If you have questions about your personal supplements and how you're changing your regimen and what you should add, that's actually something to bring up in a free consultation to see how we can support you. And we prefer not to give any medical advice over the webinar tonight. There's also some information that local hospitals are accepting mask donations. So if you have masks and you're not using them, local area hospitals are looking people to offer masks that are available. If anyone can help, it would be a chance to make a difference, this respondent writes. Please contact your area hospitals for info and how to proceed. Thank you for that.
We're also asking people to make masks. I actually was speaking with my sister this afternoon who sews, and she was dropping off masks to a clinic who had requested them. So as you're thinking, they're very simple to make. I think different fabric stores may be even donating fabric.
Another question from Barb. What about getting supplements from PIM office that are not available via FullScript? Unfortunately, we're not able to, we're not at the office. We don't have any staff at the office to have that transaction, and we want to model for our patients shelter in place and social distancing. So unfortunately, we cannot provide supplements via our physical office.
If you have particular supplements that you are concerned about and you are one of our patients, please reach out to us through our portal in the usual way that you would, and we'll see, to help address this.
Another family member is being very creative. She is checking on her 93-year-old mother. She's filling a pill container, checking food supplies, and checking her overall well-being. In order to maintain safety for herself, she's saying, I try to keep a 6-foot distance between us just in case. I'm otherwise staying at home except for visiting my mother every 4 days or so, and also some food shopping. So if at all possible, see if you can also transition to home delivery of groceries, just so you can limit the number of times you have to leave your home. I know that it's a lot to ask, and I'm experiencing it myself, but I have not left the house and gotten in my car to do an errand since Friday, March 13th. And think that this is a period of time where we're going to be asking each other to do that. Some of our areas of the country are waking up to this now. So in terms of this question, I'd say just as long as you understand the way this virus is communicated, it is through aerosols as well. So the virus, if it's sneezed into the air, can stay present for a number of hours. It's also possible for the virus to stay active on a cardboard surface for 1 to 2 days, and for stainless steel and plastics, like plastic gloves, for that virus to stay active for 3 to 4 days. So just understanding the dynamics, we'll be continuing to give you more information of transmission. Please keep this in mind when receiving cardboard boxes, etc., and follow the CDC guidelines for food delivery. And I think we're looking at our time, and I think we're about time to complete our evening together. So unless there's anything else that another healthcare provider wants to share from the team, we're going to do a centering meditation to close. Take a moment to see where you are tonight. Are you breathing? And inviting yourself and allowing breath, giving yourself permission to breathe in and to breathe out. Tonight, we're sourcing support for you. We are a healthcare team, and we are here and fully engaged and ready to support you. See to what degree in this moment you can allow yourself to feel safe. Just notice any shifts and changes in your breathing, your posture, your belly, your jaw. We want to appreciate you taking the time for yourself tonight, taking the time to source some support and to receive support tonight. You deserve all the support in the world. No one of us is an island. So we are collaborating and supporting each other as a staff at the clinic. We have a beautiful team, and we're here for you. Thank you for your time. Have a great night.
Good evening.